The Trump administration's assault on foreign aid is not just about budgetary figures, it's about the systematic dismantling of a lifeline for millions across the globe. This lifeline, which has been built over decades, is now being severed with alarming speed and precision. With billions slashed from the United States Agency for International Development, or USAID, the repercussions are felt far and wide. These cuts are not just numbers on a spreadsheet. They translate to real-world suffering and setbacks in health and development. The very foundation of global health initiatives is crumbling. Clinics that once provided essential services are now abandoned, and buildings that housed critical health programs are falling apart. This isn't just a matter of policy, it's a matter of life and death. Families are left grieving, and children are lying in makeshift hospital beds, their futures uncertain. These cuts, orchestrated with alarming speed and ferocity, have sent shockwaves through the international community. The headlines scream of the devastation, and the faces in the streets reflect the shock and disbelief. Over 90% of USAID's foreign aid contracts, a staggering $54 billion, have been wiped out. Offices are empty, and clinics that once buzzed with activity are now shuttered. The impact is immediate and devastating, leaving health and development projects in ruins and millions clinging to the remnants of hope. People are waiting in long lines at poorly equipped clinics, desperate for the care that may never come. The world watches in disbelief as the Trump administration, with Elon Musk as its champion, labels USAID a criminal organization. This narrative is not only misleading but dangerous, undermining decades of progress. This dangerous rhetoric, coupled with the administration's actions, paints a grim picture of America's commitment to global health. Health workers are protesting, and distribution centers that once provided vital supplies are now empty. The consequences, as we are beginning to witness, are nothing short of catastrophic. Hospital hallways are crowded with patients, and medical supply rooms are bare. The world is now grappling with the reality that the beacon of hope, once represented by America's commitment to global health, has dimmed considerably. Abandoned project sites and deteriorating infrastructure tell a story of neglect and abandonment. The question remains, will the world stand by and watch as the most vulnerable pay the price for this political maneuver? International leaders are meeting, and vulnerable communities are in distress, waiting for a resolution that may never come. Subscribe to this channel, like and share this video for more intriguing contents on the health sector. Behind the sterile statistics and cold calculations of budget cuts lies a deeply human tragedy. The consequences of the Trump administration's actions are not abstract. They are measured in lives lost, futures shattered, and communities plunged into despair. Every dollar slashed from USAID translates to a mother in a remote village, unable to access life-saving medication for her child. The ripple effects of these cuts are being felt across the globe. From the shuttering of HIV/AIDS clinics in sub-Saharan Africa to the halting of vaccination programs that protect millions of children from preventable diseases, the human cost of this decision is immeasurable. The faces of these victims, often unseen and unheard, tell a story of betrayal and abandonment. They are the mothers forced to watch their children suffer and succumb to diseases that were once on the verge of eradication. They are the healthcare workers, their hands tied by a lack of resources, forced to witness the resurgence of preventable illnesses. This is not a time for silence or indifference. The world must not turn a blind eye to the suffering unfolding as a direct result of these callous cuts. The time for action, for demanding accountability, and for restoring the funding that sustains life itself is now. Sub-Saharan Africa, a region grappling with a disproportionate burden of the global HIV/AIDS epidemic, is now facing a renewed threat as vital funding dries up. The Trump administration's assault on USAID has dealt a devastating blow to programs that have, for years, provided a lifeline to millions living with HIV/AIDS. The President's Emergency Plan for AIDS Relief, known as PEPFAR, a beacon of hope and a testament to America's commitment to combating the epidemic, has not been spared from the budgetary axe. The consequences are dire. In South Africa alone, 44 HIV programs funded through PEPFAR and implemented by USAID have been abruptly halted, leaving countless individuals without access to life-saving antiretroviral treatment. The impact is immediate and devastating. Treatment interruptions, rising viral loads, and the increased risk of opportunistic infections. The progress made in combating HIV/AIDS, achieved through years of tireless efforts and significant financial investment, is now under threat. As clinics close their doors and healthcare workers are left with empty shelves, a sense of despair descends upon communities already grappling with the devastating effects of the epidemic. The world watches as a generation, once promised a future free from the grip of AIDS, now faces an uncertain and perilous tomorrow. The fight against malaria, a disease that claims the lives of hundreds of thousands each year, primarily children under the age of 5, has suffered a significant setback with the drastic cuts to USAID. Programs that distribute insecticide-treated bed nets, provide access to essential anti-malarial medication, and support critical research initiatives have been severely impacted. The consequences are already being felt in vulnerable communities across the globe. With the withdrawal of funding for mosquito control programs, mosquito populations are surging, leading to an increase in malaria transmission. Children, particularly susceptible to the disease, are bearing the brunt of this crisis. The World Health Organization has warned of a potential resurgence of malaria, reversing years of hard-won progress. The gains made in reducing malaria incidence and mortality rates are now in jeopardy. The world is at a crossroads. Allow malaria to reclaim its grip on vulnerable populations, or mobilize resources to counter this looming threat. The silence of the international community in the face of this crisis is deafening. The time for complacency is over. The world must demand accountability from the Trump administration and work tirelessly to restore funding for these life-saving initiatives. The unvaccinated future childhood immunization programs under threat. The Trump administration's assault on global health extends its reach to the most vulnerable children. Drastic cuts to USAID have placed childhood immunization programs, a cornerstone of global health security, in a precarious position. These programs, responsible for protecting millions of children from preventable diseases, are now grappling with the stark reality of dwindling resources. Gavi, the Vaccine Alliance, a critical partner in expanding access to life-saving vaccines, has been severely impacted by the cuts. The consequences are dire. Without adequate funding, Gavi's ability to procure and distribute vaccines, particularly in low-income countries, is severely compromised. The potential for outbreaks of vaccine-preventable diseases, such as measles, polio, and rotavirus, looms large. The world is on the brink of witnessing a resurgence of diseases that were once on the path to eradication. The consequences of inaction are simply unacceptable. The global community must recognize the urgency of this situation. The health and well-being of future generations are at stake. We must demand the restoration of funding for these vital programs and ensure that every child, regardless of where they are born, has the opportunity to live a healthy and fulfilling life. A legal battlefield, challenging the administration's drastic measures. The fight against the Trump administration's devastating foreign aid cuts has moved to the courtroom, as nonprofit organizations and businesses directly impacted by the cuts have filed lawsuits challenging the legality of these actions. These groups argue that the administration's decision to slash foreign aid funding has not only disrupted their operations, but also undermined their ability to provide critical services to vulnerable populations around the world. The lawsuits argue that the administration overstepped its authority in making such sweeping cuts without congressional approval. They claim that such unilateral decisions bypass the checks and balances that are fundamental to the U.S. political system, and that the cuts violate U.S. law by circumventing established budgetary procedures. This legal contention is rooted in the belief that the executive branch should not have the power to alter budget allocations without legislative oversight. One lawsuit, filed by a coalition of humanitarian organizations, contends that the administration's actions have created chaos and uncertainty, making it nearly impossible for these organizations to plan and execute their missions effectively, jeopardizing the lives of millions who depend on U.S. foreign assistance. These cuts have had a ripple effect, impacting not just the immediate recipients of aid, but also the broader communities that benefit from these programs. Another lawsuit, filed by a group of businesses that contract with USAID, argues that the abrupt cancellation of contracts has resulted in significant financial losses. These businesses, which provide essential services and goods, have been left in a precarious position and jeopardize their ability to operate. The sudden halt in funding has forced many to lay off workers, halt projects, and in some cases shut down entirely. The legal battle over foreign aid cuts is expected to be lengthy and complex, involving numerous stakeholders and a myriad of legal arguments, with the potential to reach the Supreme Court. The highest court in the land may ultimately decide the fate of these critical aid programs. The outcome of these lawsuits will have far-reaching implications for the future of U.S. foreign policy. It will set a precedent for how foreign aid is managed and could influence international relations and the lives of millions around the world who rely on U.S. assistance. The stakes are incredibly high, as these programs often mean the difference between life and death for many. The courtroom has become a critical battleground in the fight to preserve U.S. foreign aid and the essential services it provides. Legal experts and advocates are working tirelessly to present their case. The hope is that the courts will recognize the devastating impact of these cuts. Advocates believe that a favorable ruling could restore much-needed stability to these programs and compel the administration to reverse course, upholding the United States' commitment to global health and development. The world is watching, and the outcome will resonate far beyond the courtroom. The politics of aid-conflicting ideologies and the price of retreat. The Trump administration's decision to cut foreign aid is deeply rooted in a particular worldview, one that views aid as a handout rather than a strategic investment. This perspective, championed by President Trump and his allies, like Elon Musk, dismisses the importance of American leadership in addressing global challenges and seeks to redefine America's role in the world. Critics argue that this America First approach is short-sighted and ultimately detrimental to U.S. interests. They point out that foreign aid, while representing a small fraction of the overall budget, plays a vital role in promoting global stability, combating terrorism, and advancing U.S. economic interests. Furthermore, they argue that the cuts to foreign aid have tarnished America's image abroad, undermining its moral authority and credibility. The decision to retreat from global leadership, they contend, leaves a void that other actors, some with interests contrary to those of the United States, are all too eager to fill. The debate over foreign aid reflects a larger philosophical divide within American society, one that pits those who believe in a more isolationist approach to foreign policy against those who see engagement with the world as essential to U.S. security and prosperity. Echoes of despair. Global leaders sound the alarm on aid devastation. The international community has reacted with alarm and dismay at the Trump administration's drastic cuts to foreign aid, recognizing the devastating consequences for global health and development. These cuts have sent shockwaves through international organizations and governments alike, as they scramble to assess the full impact on their ongoing projects and future plans. World leaders, health experts, and humanitarian organizations have condemned the cuts, warning of a humanitarian crisis of unprecedented proportions. They argue that the reduction in aid will not only affect immediate relief efforts, but also long-term development goals, potentially reversing years of progress in some of the world's most vulnerable regions. The Director General of the World Health Organization has expressed deep concern over the cuts, stating that they will set back global health progress by decades and lead to untold suffering and loss of life. He emphasized that the cuts could cripple efforts to control and eradicate diseases that have plagued humanity for centuries. The WHO has warned that the cuts will severely hamper efforts to combat diseases like HIV/AIDS, malaria, and tuberculosis, as well as undermine essential immunization programs. These programs are vital for preventing outbreaks and ensuring that children in developing countries receive the vaccines they need to survive and thrive. The President of the African Union has condemned the cuts, calling them morally reprehensible and a betrayal of the world's most vulnerable people. He highlighted the critical role that foreign aid plays in supporting health, education, and economic development across the African continent. African leaders have expressed particular concern over the impact of the cuts on HIV/AIDS programs, which have been instrumental in providing life-saving treatment to millions in Africa. These programs have not only saved lives, but also helped to reduce the stigma associated with the disease, fostering a more inclusive and supportive environment for those affected. The international community's message is clear. The Trump administration's decision to gut foreign aid is reckless, short-sighted, and will have devastating consequences for the world's most vulnerable people. The cuts are seen as a step backward in the global fight against poverty, disease, and inequality. The world is urging the administration to reverse course and uphold America's commitment to global health and development. There is a collective call for action, emphasizing that the stakes are too high and the potential human cost too great to ignore. Share your thoughts in the comments section. See you on the next one.